ABCD action plans plays a vital part in assessing whether a patient has any life-threatening conditions and if any immediate first aid is necessary. This plan is taught in first aid training courses and bring a structured method to attending scene of an accident.
D stands for danger. Ensure the area is safe for yourself, others, and the casualty.
Response. Check for the person response, ask the person name, and squeeze the shoulder. If the person does not respond, ask for help. If the person responds, make the person comfortable and check for injuries.
Send for help. Call for an ambulance or ask another person to make the call.
For airway, open mouth, check for foreign material. No foreign material, leave on back. Open airway by tilting head with chin lift. Foreign material in mouth, place casualty in recovery position. Mouth slightly downward, clear airway with fingers.
Breathing. Check for breathing. Look and feel for chest movement. Listen for air escaping from mouth and nose. An occasional gasp is not adequate for normal breathing. Circulation. Perform chest compressions to keep blood circulating, as well as rescue breathing. If the person is breathing but unresponsive, check their pulse. If their heart has stopped, provide chest compressions.
D means disability. For disability assessment, deadly bleeding, or automated external defibrillator, which is a device that shocks the heart so it begins beating.
Examination. Evaluating the person for the signs of injury, bleeding, allergy, and other problems once you know the person is breathing and their heart is beating.
Laceration. Stop the flow of blood by applying firm pressure to the laceration with a clean cloth or gauze. A small amount of blood is advantageous in cleansing the wound, but large amount of blood loss can be dangerous. Properly clean the wound. First, remove all dirt and debris by running cool water over the area, and then clean with a sterile cloth, warm water, and mild soap. Applying antibiotic ointment, and then cover the wound area with a sterile gauze bandage and first aid tape. Clean the wound area daily with soap and water and apply a fresh sterile bandage. For a minor laceration, remove the bandage after a couple of days to promote healing.
Puncture wound. First, wash your hands. This helps prevent infection. Second, stop the bleeding. Apply gentle pressure with a clean bandage or cloth. Clean the wound. Rinse the wound with a clear water for 5-10 minutes. Apply an antibiotic. Apply a thin layer of antibiotic cream or ointment. For the first 2 days, wash the area and reapply the antibiotic when you change the dressing. Cover the wound. Bandage help keep the wound clean. Change the dressing. Do this daily or whenever the bandage becomes wet or dirty. Watch for signs of infection. See a doctor if the wound isn't healing or you notice any increasing pain, swelling or fever, or light skin. Spreading redness is a sign of infection.
Cool the burn, hold the area under cool, running water for above 10 minutes. Remove rings or other tight item from the burn area. Try to do this quickly and gentle before the area swells. If a blister doesn't break, gently clean the area with water and apply antibiotic ointment. After burn is cooled, apply a lotion. This helps prevent drying and provides relief. Then bandage the burn. Cover the burn with a clean bandage. Wrap it loosely to avoid putting pressure on burned skin. Bandaging keeps air off the area, reduces pain, and protects blister skin.
Avulsin, wash your hands. Cleaning a wound with dirty hands increases the risk of infection, even if your hands appear clean before doing anything to a wound. Wash your hands through roughly with soap. Rub your hands under water for at least 20 seconds and use soap to remove germs and bacteria that may cause infection. Stop the bleeding. The next step is to stop bleeding from the wound. You should do this by applying pressure to the wound and allow the blood to clot. Make sure to use a clean cloth or bandage when applying pressure to the wound. Also, raise the part of the body that has suffered the wound. Gravity will help keep blood from rushing to the wound site, which will help stop the bleeding. Wash the wound. Once the bleeding stops, it's the best to clean the wound with running water. Be gentle while you clean it. You may notice a stinging sensation, pain, and some slightly bleeding when you clean it. This is normal. Dry the wound with a clean cloth. Apply antibiotic. Apply an antibiotic ointment to the wound. The antibiotic will prevent the growth of bacteria that may lead to an infection. A thin layer of Basitacrine antibiotic ointment is enough. Cover the wound. Use sterilized dressing to cover the wound. The goal is to protect the wound from outside elements as it heals. If the wound is minor, you don't have to cover it with sterilized dressing, and a simple bandage will do. However, for moderate sized wounds, it's best to cover with sterile dressing and tape. Do not tighten the dressing too much or keep it too loose. It should fit well over the wound so it doesn't slip off but should not cut off.